previously, before I got to the University of Gibraltar, I was working at the Wellman Center for Photomedicine, which is a principal thematic center at the Massachusetts General Hospital and Harvard Medical School, where we were trying to exploit the use of light to treat infectious diseases.
Very interesting.
So I've worked a lot in this area, and I really, at least even from a laboratory point of view, I've seen it happen. Bacteria, they're growing, they're susceptible to antibiotics. You give them a few passages under the influence or the exposure to an antibiotic, and then they are no longer susceptible. And, this can happen really, really quickly. And the most important thing to understand about antibiotic resistance or antimicrobial resistance is that it isn't just the fact that the organism can no longer be killed or inhibited by this particular drug or whatever. It's actually more complicated than that. So whenever you treat any kind of disease, there is always something called a therapeutic window. So that is the concentration of a drug that may be safely taken. So for example, you can't just give a patient an enormous amount of a medication because it can have deleterious effects on their health. So for example, when we're talking about antibiotic resistance, what we are saying is that the concentration necessary to inhibit or destroy the organism exceeds what would be safely administered. That's what we're talking about. And that's why we have all these benchmarks for antibiotic resistance. If we do not solve this problem, it's going to be tremendously difficult to treat.